Good morning, everyone.
Good morning, Elvis.
Okay, because I can't see the members in the team. I don't know who can see. Dr. John, are you in? Anyone who can see Dr. John or anyone from the PrEP or HTS team or NASCOP?
Good morning, Elvis. This is Ruth. I've just joined. Kindly.
Oh, okay. Yeah, yes, Ruth. So probably Ruth, I don't know, because I think we all know aware of the objective of the meeting. So probably maybe you will help us coordinate in terms of when the quorum is adequate. Is that in order, Ruth?
That's okay.
Yeah, because these are training, so we don't expect to have much remarks. So
That's okay.
I just wanted so that so quorum ikikua, we can start. Ruth, sindio?
Sawa.
Good morning. Good morning.
Morning, morning.
Good morning, Dr. Alexia.
Yes, I think we have quorum. We can start.
Oh, yeah, Dr. Riek.
Good morning, Dr. John. Maybe before you bring your opening remarks, we can confirm if we have participation from all the counties that were present. The CASCOs in the house, kindly just confirm.
Good morning, everyone. My name is Maureen Zawadi Karisa, Kilifi County. I'm sitting in for the Casco Maria, who will join us later on. Thank you, and back to you.
Thank you. So we have Kilifi, I've seen we have Kajiado. Which other county?
Good morning. Kajiado County is present. Thank you, and over.
Kisumu County is present.
I see Nakuru.
Ruth, how many counties are we expecting?
I understand it's supposed to be 5. Diana, can you confirm which counties were invited?
Yes, so for this, we're expecting 5, Kisumu, Homa Bay, Kilifi, Machakos, Siaya, and also some counties missed to join yesterday. So it was open for anyone who missed yesterday to join as well.
So
Yeah.
Homa and Siaya, are they in the house?
Maybe Elvis, you could do a roll call. I've put the counties on chat, and maybe any other county that didn't join yesterday and would like to join today. Over.
Yeah, I think we have Ruth. Ruth?
Yes, I'm waiting for confirmation from Homa Bay and Siaya counties. Any representation from Homa Bay and Siaya County? Okay, we'll reach out to them, but maybe meanwhile, we can say a word of prayer and Dr. Jonah will give us some opening remarks. And then as I reach out to them, kindly let's pray. Heavenly Father, we thank you.
Recording in progress.
We thank you for your mercy and grace towards us. As we begin this meeting, we pray that you may give us grace and understanding and wisdom. In Jesus' name we pray. Amen. Over to you, Dr. Jonah.
Thank you so much, Ruth, and the SI team, and also the Validian team for organizing this meeting. So at this juncture, I think I want to express our appreciation to each and every one of you for finding time to join in this meeting. At this time, our country is getting into a new era that we are going to usher in the long-acting injectable drug. And we really are glad that the drug is already here. And therefore, what now remains is for us to start implementing. It is a journey that we have been preparing for since last year. And to that end, we've been trying to put in as much preparation as possible, including making sure that we work with and through the county leadership to select the facilities that are going to be among the phase 1 implementers. And therefore, it is a great opportunity for the counties that are represented here to be among the first 15 counties that are going to implement. We wanted at least to have 18 phases, the different 5 counties for 3 days, so that we can be able to have maximum participation from all the participating facilities, so that we can interact with those who are going to take us through the EMR module, and so that we can have an interaction with the facilities, so that by the time we start implementing it in the facilities that are selected, then the staff there are already confident and even can troubleshoot, or if they may not, they already know where to seek help. And therefore, as lenacapavir comes in, this is going to be an additional PrEP choice for the clients. in addition to the Kabele that is going to come, and also in addition to the oral prep. So therefore, it is very important that we go through this session so that when it comes to monitoring and even keeping our records, we are able to be very accurate so that we can also see how the system can help us to be more effective even in tracking our clients. Because being an innovator drug, it has never been administered before. There might be a little bit of confusion in the initial phase between the Kabele and the lenacapavir, and therefore that is why in our level we felt that it is very important that we take you through this module and how you're going to use it to report. Other is without taking a lot of your time, because I know that even after this meeting you have other engagements. I really want to wish and welcome you and even appreciate the county leadership for accepting to let you attend this meeting, and we look forward to more collaboration with you so that we make it a good start. The launch is going to be on 26th next week, and therefore we are working around the clock with KEMSA to ensure that you get the commodities probably in the course of next week, so that by the time we launch, at least you'll be having the commodities. We are really going to try to be as efficient as possible to ensure that we take the shortest time to make the drugs be available. But otherwise, in terms of EMR, that is the system we are going to use to report upwards so that it is more efficient and fast for us to be able to track and monitor the implementation. Thank you so much, Team Palladium, also for accepting to take us through this and lead us in this. And we are in to participate, and I welcome you all. With those few remarks, I hand it over to Elvis, to Songok, so that you can be able to take us through the next phase. Karibuni nyote.
Yeah, thank you, Dr. Jonah. I think for those, so that we do not still delay in terms of what is next, I think we can just go straight to the Dr. Jonah.
Yes, Elvis?
Yeah, I'm saying we can just move straight to the training.
Oh, yes, sure. That is the next phase. Thank you.
Yeah. So I'll take this opportunity to welcome our colleagues from Palladium, just to give us an insight, and then at the end I'll come with a call of action or what is the next step that we will be doing after the training. So probably I'll hand it over to Diana and Tim.
Thanks, Elvis. I think there was a programmatic presentation from the program that should come before the training for the system.
Okay, so the program, who is presenting?
It's what Dr. Jonah has summarized.
Okay.
Through his
Yes.
points.
So yeah, so we can just go through the system. Diana and Tim.
Okay. Maybe then we can share those slides that were shared yesterday so that the team in this training can benefit from the program approach. And as we showcase what we've done in the system to support the program on the same. So we'll have different sessions looking at Kenya EMR, and also we have a session. We've made also some changes to DWAPI so that some new PrEP variables are transmitted to the warehouse. Changes have been made also to ensure that we have some dashboards where the program will be monitoring progress. as the facilities take up, or as the clients take up the use of lenacapavir. So I'll welcome Otieno to take us through the first presentation, and then he will welcome the next person. Bernard, are you ready?
Sure. Then I confirm that you can hear me. Am I audible, Dana?
Yes, you are. Go ahead.
Right. Thanks. So I'll just go ahead and share my screen as we begin. So yeah, I want to hope that my screen is also visible, so that as we begin, you can see what we have. So once again, good morning. My name is Bernard Otieno from Palladium. So I'll take this opportunity to just very quickly go through the new version of TaifaCare powered by Kenya EMR. So what I'm going to present is actually the DHA compliant version of TaifaCare. So once you upgrade your facilities, this is what you're likely to have. So I'll just take you through different components to be sure that you'll be able to know where to find what as you navigate the new interface. So the new interface looks as it is on your screen. So we have the landing page that is shown right now. So on the landing page, we have a facility dashboard. So in the facility dashboard, you'll be able to see statistics and graphs around the top 10 diseases for under 5 and for over 5. You'll be able to see the OPG attendance for under 5 and over 5 as well. Emergency cases, referrals, referrals in and out, as well as admissions versus the OPD visit. So that is kind of like a graph that shows you that. Okay, so this applies more, and I think it's important to note at this point that the DHA compliant version of Kenya EMR is actually developed for hospital-wide use case. So you'll see a lot of OPD and IPD modules, as well as the MOG. So just for your attention, the system is optimized for facility-wide use case. So even as you implement, if you're implementing for HIV, that's still okay, but you need to know where to find those particular HIV-related forms, HIV-related programs, and also just pay attention as we go through this. So first, I'll start with the with the topmost bar, where we have the TaifaCare, the green bar, just to know what is contained right there. So we have the big TaifaCare logo right there. If you click on that, that takes you home. So that is like a home button. So if you click on TaifaCare, it takes you home. We have the location that has logged in. So that will be like the current location that has logged in. And that location can be changed. You can change the location by clicking on it. For instance, if you are in the let's say main store, or you're in the main pharmacy, you'll need to log into the main pharmacy or the main store for you to transact operations within that particular service point. So that is very important. Again, also, we have the search right here. So this is for local search. It will search for patients within your local instance. For instance, if I want to find a patient that's existing or is coming in for a revisit, that maybe was already registered within the system, DHA recommends that we do all our searches using the patient national ID number. So if the patient has a national ID number, they just tell you that, and then you type it on that particular box. No need to press enter. You'll be able to get the patient with that particular ID. You click on their name and you proceed with service delivery. So that is how we do local search using the TaifaCare. Someone mute your mic, kindly, Eunice. Yeah, so the next icon is the add patient.
Yeah, Otieno,
Yes.
I think they were requesting that you can be able to zoom so that they can be able to see it clearly. That's the reason as to why they were unmuting. Thank you.
Is that okay? I've tried to zoom to max it out. I think that is visible now. Confirm?
Yes,
Confirm.
yes.
All right. Good. Yeah, so the next one is the manual way of registering. I'll explain a little bit about that shortly. The next one is your account. This is everything about your account. You can change your language, you can change your password, you can log out. Then we have additional modules. I will come to that slightly late. So I want us to refocus our attention to the left navigation tab right here. So we have a lot of stuff. If you compare what this arrangement and the arrangement that you have in your current version, especially for facilities that are still running version 19.2 something, you'll realize that this arrangement is a bit different. So the DHA compliant version of TaifaCare of KenyaMar, comes with a bit more refined and streamlined workflow, coming in from the registration all the way to the MOG. So it kind of mimics the facility, the typical facility workflow, where the patient comes in for registration, triage, consultation, all the way. And in the unlikely event the patient loses life, there's also the mortuary module that kind of supports all that. So I want to just rush through the different items under the left navigation tab so that we can understand how that workflow works. So the first thing is the registration. So this is the screen you'll be able to see when you upgrade. So for all patients that are being registered, it is a strong recommendation by the ministry and the DHA that you don't manually register patients. So the patients are supposed to be onboarded through searching for them using the national ID. The system is linked to the HIE. It will be able to retrieve the patient's ID using their national ID details. So for instance, if you want to, let's say, register a new patient that is coming in today, and the patient has given you their ID, all you need to do is to enter their ID here, and then you perform a search. So that will go online, it will search for that particular patient, and the patient will be retrieved here. So to comply with the privacy and data protection requirements, it will ask you to send a one-time password to the patient to ensure that the patient accepts or allows you to download their information from the HIE to this particular instance of TaifaCare. So this is kind of like a security process so that the patient also participates in consenting for their details to come down to this particular instance. Otherwise, for patients without ID, like small kids, or in extreme circumstances where patients cannot be, where you cannot obtain their IDs, maybe in emergency situation, the patient is not talking, you can perform an emergency registration, the normal way you register in the current version, but then later on, you'll be required to synchronize that information with what is coming in from HIE so that you get the correct patient details. Okay, so that is how we register and onboard new patients in the system. Otherwise, for returning patients, you can just perform normal search like I've already shown up there. Then we have the next one. We have one thing to emphasize here is for you to do the HIE search like I've done, your system will need certain configurations. And this configuration will be done to you through our service desk, or we will be giving you a way to do it. But as you do that, it is a requirement again for compliance purposes to sign an undisclosure agreement with the facility or with the county so that we comply with the privacy and data protection requirements. So that is very, very important. Ensure that you're able to seek those non-disclosure agreements as well as get proper configurations done so that you're able to get you're able to perform the HIE search like I've done. So next is the triage. So right now we have a triage for different service points. So you can configure your triage for room 1, room 2, all the way, depending on your configurations at the facility. So you can have your triage room maybe for MCH, you can have a triage room 2, 3, depending on the number of triage rooms that you have. And for each of those, you'll be able to see the patients that have been sent to those particular triage. So if a patient is sent to triage room 1 and you are a nurse in that particular room, you just wait, you just put your screen on triage room 1, and all the patients that are sent to your room will be listed down here. Okay, so that is another streamlined use case for this particular version. And as I said, you can configure your triage rooms to match the number of triage rooms that you have at your facility. Then next we have consultation. Under consultation, you'll be able to have different tabs for consultation. Again, all these are configurable. You can call them what you want, and then you can provide the number of tabs depending on how many consultation rooms that you have in your facility. So you can have your consultation room 1, room 2, room 3, and all patients that are sent to your room will be displayed under that particular room, as you can see. All right. Then we have the MCH again. This is also for the MCH service point, where you can have the triage room 1 for MCH, and then you have triage room 2 or 3, depending on the number of triage rooms in your MCH, and also depending on the size of your facility. And all the patients sent to that particular queue will be listed under that particular queue. Otherwise, you can also go to the consultation under MCH and also configure your consultation rooms and call them to the name you want. And then all the patients that are queued in those particular service points will be listed, as I've said. Next item is admission. Again, for admission, this is about managing the inpatients. So this gives you certain statistics in terms of the number of beds, number of admitted patients, number of free beds, even the percentage bed occupancy. And also you're able to see a whole list of the wards that have been configured for your facility. And as you can see, I hope it will take a bit of time to load. It will be loading the list of available wards. And for each ward, you're able to see the statistics of those wards. And also you can perform certain operations under each and every ward. So for instance, if I go to the maternity ward, you just click on the maternity ward. And once you are in the maternity ward, now you have a couple of operations you can perform. You can have a list of patients that are waiting admissions, and you can proceed. And admit them. You can admit elsewhere. You can admit them within the facility. Once you admit, they are put under the admitted. And when they are under admitted, you can perform specific operations for those particular patients. For instance, if I pick this patient very fast, you'll be able to see under the inpatient, you'll be able to see a lot of forms that are available for this particular patient that then you can be able to fill as part of the inpatient. And also you can interact with them just normally as you would for any other regular patient. Okay. Yeah, that's about admissions. So we have also discharge in, then we have the discharge, depending on the stage where that patient is. Then we have the procedures. Again, this is a list of procedures that have been ordered. So for instance, if a doctor orders a particular procedure, that order will come under the procedures ordered. Once they have been accepted, they are put under the work list. Once the procedure is done, then they can be put under completed, or depending on the complexity and decision of the procedure or the person handling the procedure, they can refer that procedure out, or they can reject it so that it is put under the procedures not done. Okay. And at this point, you can also order procedures if maybe it was not ordered from the OPD or ordered by a different service point. You can order for that procedure, and then you proceed and perform it. Next is radiology. Again, also, this is for all the orders that falls under the radiology and imaging services. All the active orders will be listed here, under here. And once they have been accepted, they'll form part of the work list. And once they form part of the work list, you can also filter and even go back to a previous date so that you can see the previously ordered radiology and imaging. And where you have like a referred out, they'll be listed there. If the radiology result is pending review, they'll be placed under here for review. And once they're reviewed and approved, they'll be placed under the approved tab. If they are not done, then we'll be able to see not done right there. Okay, so we have the lab next. Again, the workflow remains the same. For the lab, you'll see the test ordered. Like for Mary, you'll see that this is a routine test ordered. The order is not picked yet. The lab person, the lab technician, has a choice to make whether to reject the request or to bill if it is available a lab test. Once, if it is available lab test, they'll be able to raise the bill and say this is the bill. They'll be able to pay this amount of money, and then they say, once they do that, that will send the patient to the cash office so that then they pay for that lab service. Then once they are paid up, they'll be able to now pick up the lab request so that they can start conducting the lab test. They can come in under progress. They'll be able to see all the tests that are currently under test that are pending result. So the status of those are indicated as in progress. How do they add the lab result? They just say add lab result. They enter that particular result there, and then they save and close. That will move that particular test under completed, and also send that copy of result back to the clinician so that it can be disseminated to the patient for purposes of patient management. Okay. The next one is the pharmacy. Now, pharmacy is where they'll be able to now dispense the medication to the patient. And for the pharmacist, they'll just extend that particular tab and then have options. The options that are available include the close, pause, or dispense. But in particular case where the drug is supposed to be paid for, the pharmacist will be able to raise the bill, and that will send the patient to the cash office for payment. Until they make the payment, that drug will not be able to be dispensed until that patient makes that payment. Once they make the payment, then it can turn into, I don't know if I can get one that has a dispense. Yeah, so once it is paid, they'll be able to now get this button for dispense so that they can dispense that particular drug. Otherwise, if the drug is missing in the stock or in their store, then we'll see a notification about all stock. So that means they can then print that prescription and then they give it to the patient so that they can try and maybe buy that drug from a different pharmacist. Yeah, so that's about the pharmacy. Next one is accounting, especially for the facility that will be implementing this as part of as a facility-wide, where they'll be able to pay. So for accounting is where the patient will be making their payments for all the services and commodities that are consumed. So for instance, at the billing page, they'll be able to see the bills for today, and then they'll be able to pick that bill Like for instance, our test John patient has a bill of 300. They'll be able to come here. They are able to print the invoice or print a receipt or print bill statement, add additional bill if at all there's any. At this point, they can also perform M-Pesa STK push, which will just prompt the patient on their phone to put in the M-Pesa PIN so that the payment can be received. Otherwise, they can do manual payment through the add payment option. There are configurable methods of payment, including cash, insurance, M-Pesa, and all that. You can configure those. Once the amount is paid, they process the payment so that then the patient can proceed with the receiving services. Okay. Otherwise, also, sorry, we can also have the claims. The system is linked to the claims management system, where the facility is able to submit claims electronically, and also pre-authorization is supported again through the same link. The system is able to submit and receive authorization for particular operations for that particular patient. So all that is supported. Again, also, when it comes to mortuary, mortuary also is a workflow, just like any other service point. So you have the list of patients awaiting, not patients, sorry. You have the list of bodies that are awaiting admission. Then you can have the list of bodies that have been admitted, and also list of discharged bodies. So all that, all those operations have different forms that you fill and submit as the body moves through each stage until the body is discharged. Okay, so that is like an overview of the TaifaCare. So lastly, I just want to do a quick overview of what you'll now see when you get into a patient file. So if you get into a patient file, you'll be able to interact with you'll be able to interact with now different sections. So there's the information provided, like as you can see on the screen, under patient summary. We have the vitals and anthropometrics. If they're out of date, you'll get that alert that they're out of date so that you can capture very recent details about the vitals. And also, you'll have the patient summary about complaints, conditions, allergies, and all. Then we have the list of vitals ever taken. So it is like an historical kind of list of vitals and anthropometrics, which you can view you can view as a list or you can view as a graph. Then we have the care panel. We'll come back to this later in the next presentation, where you'll be able to now enroll the patient in different programs, including HIV, and also including the PrEP, which we'll be seeing in the next presentation on how we are able to correctly enroll our patient into PrEP's program. Then you'll have the immunizations, the list of all the immunizations and relationships, and it goes on and on. You can have the appointments. For instance, Mary is expected to come back to the facility on this date in August 13th, and it is scheduled, and you are able to edit that or cancel that. You can see the appointments given today and even the past appointment. If there are any attachments, like our patient Mary has got a radiology result for X-ray, you can be able to interact with that. And that list goes and goes, and you can also find photograph and other details depending on the type of patient. Then you can have the clinical encounter, where you're able to see visit details in summary. You can see different sections of the clinical encounter. We have the visit details, we have the patient history, we have the patient examination, patient management, and we have a whole list of lab results, if at all they are available. Then you can have visits. This can list all the visits by this particular patient in this facility. So you can see the details of each and every visit that was made by this patient. And you can also expand and drill down to even see what details were captured for each and every visit. Okay. So like, for instance, we can see what was filled in the PrEP behavior. You can see all this that were filled on 20th January. You are able to edit this encounter, and in worst case scenario that is not advisable, you can delete, but it's not advisable that you delete patients' clinical details. Then we have special clinics, a whole list of them from audiology, cardiology, dental, all the way to POPC, SOPC, all the way to urology. So all these are available, and you are able to interact with them as part of the special clinics. Lab orders. For lab orders, you'll be able to now see all the lab orders that have been performed for this particular patient, and also you'll be able to also interact with their results if at all the results were posted. Right? And you can also go ahead and add new orders. We have radiology and imaging. We've seen this, and you're able to also show their results if the results are available from the radiology department. Then we have the procedures. Again, all the procedures that have been ordered for Mary and all the results for those procedures. Prescriptions also will have all the prescriptions that have been ordered for Mary. And again, we'll be able to interact with the active medication for Mary, and also we'll be able to interact with all the past medication that have ever been prescribed to Mary. And then for inpatient, in a case where Mary is admitted, we'll be able to interact with their inpatient details, and also we'll be able to even record admission request. If at all Mary is supposed to be admitted, we can send an admission request so that the admission process begins. Okay, so that in a summary, in a nutshell, is what you'll be able to have in a patient profile. You can perform several other things, several other operations for that particular patient, including you can record vitals, you can make orders. For instance, you can make drug orders, you can make laboratory orders, you can even make imaging orders, you can make procedure orders, you can even order for medical supplies from the order basket. Then you have the forms. This is where you find all the applicable forms for this particular patient, all of them. But a disclaimer, there are some forms that are not being displayed to you automatically because the patient is not registered in any of those programs. So for instance, if you have, let's say, a patient that is not enrolled in a PrEP program, you'll not be able to see the PrEP forms in this list. So until you properly admit them, enroll them in a program, is when you can interact with the related forms for that particular program. So that is very, very important, so that you don't go and say, I didn't see this form. That form is there, just that the patient is not applicable to the current patient because they are not enrolled in that particular program. So it's good to note. Okay. Yeah, so we'll see more of this as we move along with the presentations. So lastly, I want to bring your attention to the additional modules. So with additional modules, we have so many more that you can interact with. For instance, you can interact with facility dashboards. You'll be able to see that, especially for those who are those facilities that are monitoring their case surveillance, the HIV case surveillance. You'll be able to interact with them under the dashboards. You are able to manage stock. The system is equipped with a very comprehensive stock management module that kind of help you to manage your stocks, your consumables, both pharmaceuticals and non-pharmaceuticals. Then we have the billing admin, where you set up the prices for different commodities and for different services. Then you have the dispensing app. We've seen that. This is where the pharmacist will be sitting. So when they come in, they just click dispensing app. That takes them to their module where they'll be able to now wait for patients to show up in their queue as they dispense. We have the supplies dispensing. We have the lab manifest. We have the bed management, where you are able to add new beds, create the identity and their configurations within the wards. And then we have the administration. Allow me to show something small about the administration. So under the new administration module, you'll be able to manage users, adding users, changing their passwords and all, depending on your level of access. Then we have the ETL administration for all your reports and the DWAP. You'll be able to have different ETL operations where you are able to refresh tables, you are able to refresh DWAP tables, recreate data tools, and create facility-wide tables. This is important as you run your report, so that you are sure that you're running the latest reports. So before any report, always refresh this so that you get accurate reports. Then we have the location, where you are able to now configure different locations: main pharmacy, main store, blah, 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 sub-store. I'm told nowadays there are sub-stores within certain service points like MCH. You are able to configure all those under the locations. And then you also have the facility details. So that is what is available under the administration. Then we have the cross-border ADSR assessment. We have the reports. We have the legacy admin. I think we are familiar with that. Service queue admin, referrals, appointment, case management, and queue screen for those who have those the TVs that talk about customer XYZ, please proceed to desk number XYZ. Yeah, so that you can do under the queue screens. So in a nutshell, that's what the new version of TaifaCare entails. This is version 19.3.2. And this is the version that you will be expected to upgrade after this particular training. So it's good to just kind of see and understand where to get what as you prepare to roll out. Yes, so up to that point, I would like to stop it there and allow my colleague Miriam to take over to just take us through the initial processes of patient testing that will take us all the way to the PrEP workflow. So, Marianne, if you are available, can you take over? Thanks.
Thank you, Tina. Good morning, everybody. My name is Marianne Mwangi. Confirm you can hear me as I share my screen.
Yes, you're audible.
Okay. My screen is up. My screen is visible.
Yes.
Okay.
Yes,
Then you can
yes.
proceed. All right, so I'm going to take us through the clinical workflow of a patient who is coming to the facility seeking HTS services, who will eventually end up being given PrEP as a prevention service. So our starting. Sorry?
Oh, I thought it could be in a presentation mode, but it's okay.
I'm sharing my screen. It's an online training instance that I'm sharing. All right, so our starting point is going to be when a patient comes to the facility. They have been identified through the registration process from the client registry, and the patient has been registered within the database, and they can be found, and we are on the patient homepage. So from the patient homepage, we need to check in our patient, and the reason why we're checking in our patient is so that we can determine, one, what services they are seeking today for this particular visit. Our patient says they're coming for a voluntary HTS test. So at the registration desk, they will select outpatient. They're coming for outpatient services. Then we also need to determine the patient category, whether they are seeking clinical services or they're just a walking patient who maybe is just coming for a lab test, who's coming to pick drugs. In our case, our patient is. We'll start from triads so that we can offer them clinical services. So if they're coming for clinical services and we're starting with triads, we need also now to confirm what is the first service point where they will go, which is triads at the OPD, and we can select triads OPD room 1 or OPD room 2. So I'm going to place them in triads OPD room 2. Then 3, as the patients are coming seeking for services, we also need to determine how the client will pay for the payable services that will be rendered. For any service that has a service or product charge that will be offered to our patient, how will they pay? So in this case, our patient is not exempted from payment. They will be paying. Their choice of payment method is insurance, and maybe they even have something like Jubilee insurance, because currently from the top we can see our patient is not yet registered to SHA, and we can start the visit. So when you do that, the system will give us successful message. We've been able to start an outpatient visit. That means our patient now will have an active visit, and we have also managed to queue them in OPD room 2 for triad services. And we will send them now to the room to be attended by the next provider. So when the patient is sent to triad, the provider who is at triad will access the system from the triad module from where I am. By clicking the triage module, in this particular setup, we have 2 rooms. We have triage room 1 and triage room 2. Remember, we had placed our patient in triage room 2. So we're going to go to triage room 2 so that we can be able to see the queue of patients who are waiting for triage services in this room. So from this particular dashboard, our user provider who is at the triage will be able to tell clients who are waiting for services. They will also be able to tell clients who are being attended for services, and they can even be able to view that as a downloadable list. So for the patient, the provider who is in triage room 2, they will see they have 2 patients coming in today. One is already in service and one is waiting. So we will select our patient who is PrEP Friday training, and we will be able to offer them services. We can be able to see a bit of their details, their name, the current status, even for how long they have been in our queue. So we will call them into service using the 3 dots at the far right end. Use the call button just to mimic or simulate the calling of a patient, telling them to come into the room. And once we confirm that is the patient, we will be able to serve them. If the patient is not available when the provider is calling them, the system allows them to requeue, serve the next patient, and then they will serve the patient when they are available. In our case, we will assume our patient has come into the room. We have verified it is them. We're offering a service, and we will be able now to serve them. So clicking on serve now takes the provider direct to the patient homepage, so that now we can be able to document the services that we're going to offer our patient. So for triage, our main concern is to record vitals. So we're going to use the link for record vitals. So even right now, we can be able to tell we do not have any data that has been recorded for this patient for any vitals or any biometrics information. So we're going to use the record vitals link. When you do that, it is going to pop up a triage form, which we will fill quickly so that we can triage our patient and proceed to queue them to another service. So the first thing in the triage form are the visit details, which are auto-picked by the system as per when we are seeing our patient during this visit. That is the visit date, which is today, the provider who is performing this particular service, and the location where we are doing this from the OPD. So we'll start by looking at the patients, whether they have any complaints or history of complaints, asking the question if the patient has any complaints today. If we say yes, or the patient says yes, the system will allow you to add as many presenting complaints as the patient says, selecting the complaint itself, the duration of days they have been experiencing that. Maybe they came in with a back pain for the last 3 days, and the onset status, whether it is gradual or it has been sudden. And they can be able to add as many complaints as the client or the patient is going to give them. Then we're going to go to physical assessment, physically assess the patient, whether they are walking, whether they are standing or walking with health, whether they are immobile, they are on a stretcher, or in our case, you'll say our patient came in walking. Then we need to determine whether the patient has had any injury within the last 24 hours. Our patient says they have not had any injury, so we're going to select no. Then we're also going to look at the patient's level of consciousness. That is looking at now whether they are alert, they are reacting to voice. That is basically looking at alert, voice, pain, and how the patient is responsive. So we're going to say our patient is alert. Then we're going to fill vital signs, which we're going to take. Or for example, starting with temperature, we're going to take a temperature reading. Maybe our patient has a 36.2 reading. Mode of collection, we use the thermogun. Then pulse rate, we're going to say around 70. Blood pressure, starting with systolic pressure, maybe 116. Diastolic at around 72. And then we're going to document the respiratory rate for our patient. You can see around 18. Oxygen saturation, maybe 98%. And the mode of collection was through room air. Then we're going to proceed to fill now the anthropometric section, looking at weight. Our patient is 16 years of age. They are around maybe 31 kgs, a bit malnourished. Height, 140 centimeters. And the system is going to auto-calculate for you BMI using height and weight, and it is also going to give a nutrition status associated with that BMI, where we find our patient has severe acute malnutrition. Then now, depending on the patient that we are serving, this question will pop up. If our patient is female, their last menstrual period date, and we can say maybe sometime last month. And then now the system is going to categorize TEWs. That is triage early warning signs. And what it does, it allocates a point for each vital sign. They are assigned between 0 and 2. And an overall composite score is generated from the presenting physiology, especially what we just filled above. So what does this TEW score mean in Kenya EMR? So for points greater than 7 or equal to 7, it will give you an emergency category. 5 to 6 points will give you very urgent. 3 to 4 points will give you urgent. 0 to 2 points will give you routine care category. So in our case, the overall composite score is giving us an overall score of 1, which will place our patient at routine care. Then we can proceed to write some triage notes if there are any. We can say our patient is seeking HTS services at the hospital, and we can proceed to save and close the form. So when we do that, we'll get a successful message that the form has been fully submitted. And when you go back to the patient profile, where we did not have any data for vitals and optometrics, you can be able to see we have some recordings for today, current vital history, and we can even tell some of the statistics that we just filled. The BP, the heart rate, the respiratory rate, weight, height, BMI, all of them, as we have just captured. And now, since we are done with that service at that particular room, we can be able to assign our patient to the next queue, where they will now be seeking the exact service of HTS, starting with screening. So we are going to assign them to a queue using the link above here. Currently, we can see they're in OPD triage room 2, but we want to move them to another room. So we'll assign to next queue using that link. This particular pop-up will come. 1, we are going to select the service location where we want to move our patient. So for this instance, allow me to select clinical consultation. I think clinical consultation has a few rooms. So I'm just going to select one room. We can say OPD room 2. And again, unfortunately, the system is going to get fixed here. It has an automatic priority for emergency. But remember, when we were categorizing our patient, the system did not categorize our patients as an emergency case. They actually categorized them as an urgent case. So for now, this is going to be a bit of manual until the system is able to auto-categorize the priority level of our patient when we are moving them along the queues. Then maybe we can say patients fully triaged, transitioned for screening for HTS screening. Again, the comments are not mandatory, but it's good just to give a heads up to the next person who will be seeing our patient. Then we can assign to the next queue. Let me try putting them in OPD room 1. Minutes I confirm the rooms we have at OPD so that I don't place our patients in the wrong room. So at the consultation, we have consultation room 1 and consultation room 2 that you can be able to use. So going back, allow me to assign our patient to the next queue. Again, we're going to select the applicable room that we have at OPD. So we have successfully been able to transition our patient to the queue. Apologies for that hitch. And now we send them to the next provider where they will be seeking services. So when the next provider, their starting point again is going to be at the exact room We send them for consultation services where they will receive testing services. And we can see some statistics given from the dashboard. These particular providers will be able to see all patients who are waiting for their consultation, any patients they may have sent for investigations, and any investigations that have been complete, and even showing the total number of visits for that particular room. So for this room that we sent to our patient consultation 1, the patient is found there. We can even be able to tell where they're coming from OPD triage room 2. Their priority level currently is urgent. If we had any priority comments like the one we had picked, we'll be able to see that there. And their current status is waiting, and even for how long they've been waiting. And now this particular user can be able to call them to service using the system. So it follows the same procedure, confirm the patient is available. They are the ones that you've called, entered the room, and now we can be able to serve. So now the system allows this provider to get into their patient homepage to be able to offer them services. Now this particular patient is coming in first so that we can determine whether they are eligible for a HTS test, and we're going to access the clinical forms using the icon that we've just been shown where we have clinical forms. And we're going to start with an eligibility screening form so that we can determine if our patient is eligible for HIV testing. So when we select the HTS eligible form, it is going to again give us a provision to document that, starting with the visit details that the system is going to auto pick, and we can start now filling the form itself. We start by providing the population type of our patient. We can say our patient is coming from the general population. Again, if you select any of the population types, it will conform to asking you more questions. For example, if you select key population, then you need to determine what type of a key population that patient is. If you select priority population, again, it's going to request what type to advance or give what type of population is. So for our case, we're going to select general population. Then we're going to proceed. Does the patient have any disability? If we say yes, the system will expect for you to check what particular disability it is, and we can be able to select more than one disability. If the disability the patient has is not among this, and we can select others, and we can be able to specify what it is. For our case, we're going to say no, our patient doesn't have any disability. Then from which department are we covering our patient? Department of coverage, you can say outpatient department. Patient type, we can say our patient is maybe a hospital patient. They were coming seeking services. Then client has any relationship with an index client. It can either be a sexual contact, social contact, or needle sharing. We can say yes. She may have a relationship with an index client, which is maybe a social contact. Then the HTS strategy being used at this particular point, we can say integrated via ICT center. HTS entry point, remember our patient came through OPD. Then history of HIV testing. We need to confirm whether our patient has been tested for HIV before. Maybe you can say yes. Who performed the test? Was it a HTS provider, or was it a self-administered test? We can say a HTS provider. Then we'll need to input the results of the previous test. Maybe it was a negative outcome, and even the last date our patient was tested. We can say maybe they were tested a year ago, sometime in January. Then we need to proceed with the form and look at risk assessment. Has the client ever had sex? Maybe she'll say yes. Is the client sexually active? She will also say yes. And then we proceed with the next question. Has the client had a new sexual partner within the last 3 months? She may decline to answer. Then the patient HIV status, again, she will say unknown. Have you engaged yourself in unprotected sex with more than one sexual partner in the last 12 months? She can say no. Does the client engage in sex under the influence of alcohol or drugs? She can say sometimes. Then have you ever had unprotected sex in exchange for money? She would say no. Have you recently had any incident of condomus? She may decline to answer. And then have you engaged in unprotected sex with someone you don't know the HIV status within the last 12 months? Maybe she can say no. Have you had unprotected sex with someone who has known HIV positive status? She can say no. Any traditional and medical procedures experience like circumcision, plastic tooth extraction, and the likes? Say no. Then we proceed to screen for violence. Has the client recently experienced any violence? You can say no. But if we say yes, the system will follow up with some questions so that we can determine whether it was sexual or physical violence. And again, the client has been forced to participate in sexual activity against their will. For this instance, we're going to say the client has not had any recent experience in violence. Then we're going to proceed to preventive care assessment, seeking whether any PrEP services have been offered before to our patient. She says no. PEP, again, no. STI service, she may say yes for that one. And we're going to go to the TB risk assessment so that we can be able to screen our patient for TB and proceed to ask the questions. Whether you have had a cough of any duration, they'll say no. Client has had a fever, no. Noticeable weight or poor weight gain, can say no. Client experiencing night sweats, no. So that means the system will categorize the resulting TB status as having the patient having no signs for TB. Then we proceed to pregnancy assessment. Now, this section for pregnancy assessment will only be available depending on the patient we're seeing. This one is available because our patient is female of reproductive age. Is the patient currently pregnant? Maybe she says no. A breastfeeding mother, again, no. And then we can now proceed to now eligibility and referral for testing. Is client eligible for testing? Again, depending on the provider assessment to how our client has answered the questions, we can be able to determine that yes, the client is eligible for testing, and also proceed to validate the same with generating a HIV risk category. So when we do this, the system has been provided with a HTS machine learning model that has been trained to find patterns in patient demographic, behavioral risk factors, sexual behavior history, population type. It also uses population estimates, area prevalence of HIV, use of condoms, STI prevalence, previous STI cases, multiple partners, prediction, so that we can be able now to predict how likely a client will turn to be HIV positive when a HIV test is administered. So this outcome is based on a weighted scoring, and the HIV risk stratification using the mentioned features is given using a combination of now people, place, and time factors. So for example, for our patient, when all this has been applied using the machine learning model, the stratification we get is that our patient has a medium risk, categorized as a medium risk client. That means the client has a medium probability of a HIV positive test result, and testing is actually recommended. So that means a medium HIV risk category has been selected by the system. So now we can proceed. Do you recommend HIV testing now? Based on the questions we have asked above, and now the machine learning categorization, the provider can say yes. And we also need to determine the reason why they are recommending HIV testing. Was it upon their own discretion? Was it based on the risk screening findings above? Or was it based on the machine learning risk category? Or was it based on HTS guidelines? And a provider can be able to pick any of those. So we're going to say based on the risk screening findings, and also maybe because of the machine learning risk category. And then now we confirm that the client has actually been referred for testing. And we can be able to save and close that particular form. So when we do that, the system again is going to give us a successful message. We've been able to test our patients, screen them for testing, and we determine that they're eligible for testing. And now again, we can be able to either, if testing happens in the same room, we can proceed to test them, or we can assign them to the next queue where they will receive particular testing services. So for this instance, maybe testing happens in the same room. So we will proceed to search for among the clinical forms again, the HTS initial form that will enable us or help us to document the testing process for our patient. So when we select the HTS initial form, again, the system is going to load for us the form. Visit details are auto-picked by the system, and we are going to proceed to fill the form. So starting again with the population type, our patient was a general population patient. Our patient did not have any disability, and when we proceed to the HIV testing history. Has the client ever been tested for HIV by HTS provider? We had determined that, and that was a year ago. So we're going to say it was 12 months ago. Then has the client done HIV self-test within the 12 months? She had said no. So even in this, but for this particular instance, she's saying no. Then the setting where this particular HTS test is taking place, it's at the facility. The approach that we used, remember this was client-initiated testing. She only came purposefully to get a HIV test and indicate the strategy that we're using. We had used integrated VCT center. Then the HTS entry point, we got our patient from OPD. Then TB screening will auto-populate from what we had done from eligibility screening, where we determined our patient does not have any signs of TB. Then we proceed now to the test itself. So the HIV test we're going to conduct, we need consent from the patient. So has the patient given consent? We're going to say yes. How are we testing our patient? They come in as an individual, so we'll select individual. And now the system is going to guide us according to the 3-tiered algorithm testing, how to proceed. So in our case, we're going to start with the first kit name, Trin screen. And we are going to proceed with this on using a ratio 1:2, that is 2 drops of blood and one drop of blood and 2 drops of buffer, with giving around a waiting period of around 10 minutes, and we're going to read our results. So from this test kit, the lot number, we're just going to put a figure of a lot number. Then the expiry date has to be in the future. So I'm going to say maybe this test kit is expiring in 2028, sometime in November. Then after the 10 minutes wait for the reaction, we are going to get that our outcome is going to be non-reactive. So that means our patient is going to get a negative result. When you do that, the system will automatically give you the final results, because when we get a negative results using the first test kit, then we'll not need to proceed to the other testings. Then we're going to give the results to our patient. Yes. Couple is discordant, that will not apply. Remember, we were testing our patient as an individual. Then now, do we need to refer our patient to any services? Client referred for other services. For this instance, we're going to say yes, because remember, when we had screened our patient, we got a medium risk categorization, meaning there was a higher probability of them turning out to be HIV positive. And again, from the behavioral questions and the sexual history she had answered, she may still be at risk, so we may need to send her for risk reduction counseling, again for condom use and dispensing, and more so for pre-exposure prophylaxis. We recommend that she be given PrEP. Then we can be able to even give some notes. So we can say enrollment to PrEP is recommended after review. So that means we are sending our patient for a review to another provider who will first of all assess our patient whether they are ready or they should be. They are actually eligible to be given PrEP. Then they can proceed to document and offer them that particular service, and we can be able to save and close that particular form. When we do that, the system is going to give us that the form has been submitted successfully. And when we go back to our patient clinical encounter, the visits for this particular time, which is today, we will be able to tell one from even the time series, what we have been able to fill. We've done a trials for our patient. We've been able to fill 2 HTS encounters. One of them was the eligibility screening form and the HTS initial form. And like Otieno had shown, again, if a provider may need to check any documentation that was done, you can either be able to expand, be able to see what was recorded. You can be able to edit or delete the encounter depending on the credentials and the level of credentials you have in the system. Some of the providers may not be able to delete a form. The same is also available. You can be able to edit an encounter using the 3 dots at the find, or you can be able to delete a particular encounter. So again, we're going to assign our patients to the next queue, where now they will be seeking the prevention services that we have recommended. So allow me again to transition our patients. They are currently in OPD consultation room 1. So I want to transition them to OPD consultation room 2. They are not an urgent case, and our comment is that recommended for prevention services. And now you can be able to assign to the next queue. Apologies for this. We seem to have a break in the assigning of the queues, but our patient will eventually be transitioned to that queue, as we had seen previously. So when we send our patient to go to the next provider, they should again now still check in their particular room to find if they will find our patient in their queue to offer them for services. So for us to proceed to the next step, I'm going to welcome my colleague, Eric, so that he can proceed. Thank you, Eric.
Thank you, Miriam. Allow me to share my screen and confirm that you can hear me. Miriam, you can confirm? Can you hear me?
Yes, Eric, we can hear you. Please proceed.
Thank you. My name is Modomi Eric, a business analyst at Palladium. I'll be taking you through the session on the PrEP, and this will be focusing on the PrEP module, starting from where Miriam has left until when we'll be dispensing the drug. Maybe before I start, just to let you know, I proceed from here, from the consultation room number 1, whereby the clinical team, or maybe, for example, the clinician, when you'll be initiating this particular client to PrEP, you can be able to pick your patient from this particular queue. These queues are configurable, and I know Otieno and Miriana talked about that. And maybe before I start, why do I need to proceed with this particular client? There are some of the criteria that needs to be met by a client for you to be eligible for PrEP. That number 1 is that we're looking at the age. This particular client, as I'll be picking my client here, Colin, must be above 15 years of age. Then number 2, according to the guidelines, we need to look at the weight of our client must be above 30 kgs. Number 3, we will be looking at the HIV status, needs to have HIV negative results that have been done within that particular encounter. And that is what Marianne has done. So for those 3 are met. So we'll be proceeding with the 4th one, whereby we need to look at the eligibility through checking one of the form that you'll be able to get under the clinical forms, known as the PrEP behavior risk assessment. So we're going to do the last assessment, and then after this assessment, we'll be able to see whether this particular patient is eligible for PrEP. The reason as to why I'm talking about those criteria is because in this new TaifaCare user interface, when you navigate to the patient chart, where we have the patient summary, the vitals and anthropometric, then the care panel. When you click on the care panel, this way you'll be able to see the program summaries for each program that this particular client will be enrolled. If you want to enroll, or maybe offer services, now you'll be required to click on the program enrollment, and then you'll be able to see all the programs this particular patient is eligible for. Right now, you'll not be able to see PrEP. Why? Because this particular client needs to meet all those the criteria that I've described. Right now, we've already met 3. We need the 4th one, and that will be through now doing the assessment. So I need to click on the PrEP behavior risk assessment form and be able to fill on this, checking on the sex partner HIV status. If it's known, then you can be able to give. And then if it, for example, HIV positive, you need to specify whether this particular partner is current on ART. If negative, then you can be able to proceed. If unknown, you can be able to see the system is likely suggesting for the unknown might be high-risk partner. Then you proceed again to look at the behavior risk of the partner, and you select all that apply. We have a list that you can be able to select from. Maybe as sex with more than one partner, and maybe recent sexually transmitted infection in the last 6 months. Then you need to check on the contraceptive. If the client is using any contraceptive, by just responding to yes or no, then we look at the assessment outcome, and this will be determined on once you've assessed this particular patient, starting from even the previous history, and Marianne has guided us on how to check the history under the visits. Then you can be able to tell it does this particular client has high risk or low risk. Then if it's high risk, then you can be able to select the risk. Then was there any risk education offered? And if it was there, you can then be able to specify yes and give the risk education that was offered, you specify it. Then there is this mandatory question here, client willing to take PrEP. This is another key aspect, because if you say no, you'll not be able to see the program under the program enrollment. But if the client is now willing, you'll be able to see it once we save the form, and then we'll be able to give any of the referral preventive service that we would want to refer. Maybe you want to refer this particular client for risk reduction counseling, and even maybe prevention and treatment of STIs, as we could be able to tell here, there was recent sexually transmitted disease. So you can be able to even have that guided. Then once we do that, we can be able to save this particular form. And once we save this form and get again back to the program enrollment, now you'll be able to see the PrEP program here appearing. So how do I proceed? I need to click on the enroll. There's another new way of enrolling that we've included in TaifaCare powered by Kenya EMR. So when I click on the enroll, a form will pop up. In this form, we only have these variables, checking on the date when we're enrolling, the provider who is enrolling, and then the location where we're enrolling this particular patient. What we required is just only to click on the save and close. Unlike there before, we used to have very many variables in our enrollment form, but we've now separated these other clinical variables from this form, because as we're moving to the facility-wide, we may notice that some of the facilities, we do not have the clinical personnel doing that enrollment. So here we just click save, then you'll be able to see that the program has been enrolled, but now we need to proceed and do the initiation that will be done by the clinical team after enrolling. So when you navigate to the two ones, right, where we have the three dots under the options, and then you click on it, you'll be able to see PrEP initiation form appearing. Otieno mentioned of some of the forms that you'll not be able to see under the clinical forms. So, and this is where we'll be able to see them. There's another new change, enhancements, where you'll be now be accessing our program forms from. So you'll be able to see the main forms from here. So you'll be able to click on the PrEP initiation, and here you'll be able to see the details, the client type, is it new client transfer, the restart and restart for those who at one point may have interrupted their treatment. So for a case, you'll be able to use new client. Then you have the population type. Is it general population, or is it key and vulnerable population? And if it's key and vulnerable population, we'll be able to select the specific type under the key and vulnerable population. So ours was a general population. Then I need to give the unique PrEP number. Need to keep the format of this particular number. If you give a number which is not as per the standard way, the system will alert and tell you that is an invalid number until you give a specified number as it should be. Then you look at the PrEP initiation details, whereby you have a question, client has previously been on PrEP, is it yes or no? So if it's yes, the system will require you to record the type of PrEP that this particular client has ever used. And here, we've noticed that we've now had lenacapavir, because it is a drug that we'll be having in our facilities, and we may get a case scenario by maybe this particular client has ever used it. So if it's no, again, you can be able to get to the client social history, and this is validated as per the age of this particular client. So once that is done, when you get back to the options and then click on it, you'll be able to see now PrEP initial form. Remember, the other one that we filled was PrEP initiation, that we're initiating you into this medication. Then now we have the PrEP start initial form. And this is the first part with more of clinical variables in it. And when you click on that, you'll be able to see again whether the partner is HIV positive. It's a question, either yes or no. Then you can be able to respond. If it's yes, there are more variables that you need to record. If it's no, then you proceed to the STI screening. And if STI screening was it done, if it was done, then you can be able to specify yes. If no, then you give no. But if you say yes, then you'll be able to see what was the outcome? You select all that applies. Maybe after STA screening, this client was normal. There was no anything that was found. Then when you click on the none, the system will be able to bar the rest of the responses. But if you find, let's say maybe, for example, there was a genital ulcer disease, then the system will open up for you to specify whether was this treated with a yes or no. And it will do that for each and every outcome that you'll be able to specify. Then we get to the fertility intentions, whether attain menopause. If no, it will not block. But if yes, for some of the clients, it will be able to block. So for my case, it is no. Then I'll be able to see other aspects coming up, whether the client, the LMP, whether the client is pregnant. Let's say these are started the menstrual cycles. Then is the client pregnant? No. But if it is yes, you'll be able to see some of the other questions coming up. But if not, then you proceed. Planning to get pregnant? No. Breastfeeding? Then you can be able to respond whether yes or no. Then using family planning status? If not using, then you can be able to proceed. If on family planning for the training purposes, you'll need to select which method this particular client is using. If wants family planning, again, you need to select which one is this particular client wants. So for my case, not using family planning, then I get to the adverse drug reactions. So client has adverse drug reactions. If yes, then we can be able to specify by clicking on add. And here you'll be able now to specify the medicine that is causing the reaction. You'll be able to see a list from there. You can be able to select the specific medicine. The reaction, we have a list. You can be able to select from there. Even the severity, we have a list. You can be able to select accordingly, and then specify the date of onset from the calendar. And then the action taken, you'll be able to see a list. If there was none here, then the system will not allow you to add. Then you get to the lab investigation, and the question is whether the serum creatinine has been done with yes or no. So if it's yes, you can again confirm. If you're doing it the same day, then you can navigate to the order basket and order for a lab test. And I know Marianne has talked about that. Then we get to the PrEP now status, any signs and symptoms of acute HIV. You'll notice if I say yes, under the PrEP treatment plan, the system will discontinue the initiation of this. So we'll now cease to even starting this PrEP. But if no, it will now allow you to proceed, whether the adherence counseling was done and the outcome, and then was there any contraindication for PrEP. The same, if there was any, the same PrEP treatment plan will block you from proceeding. But if none of any of these, then you can proceed to the PrEP treatment plan. And here you'll be able to see start, continue, restart, switch, or discontinue. So for a start, this is for the first time, and you can even be able to see it is under the PrEP initial form. In the subsequent forms, you'll be able to see start will not appear. If it's continue, maybe for some of these clients who are coming in as new in your facility, but they want to proceed with PrEP, then you'll be able to see that. If you're switching, you'll be able again to see it there and give a reason. So allow me to pick starts, then I can be able to give the reason for starting PrEP. We'll be able to see that list as it is in the guidelines, then you'll be able to pick. Then prescribe PrEP today, it's a yes or no. If no, then you proceed. If yes, then you need to specify. And something that we've introduced here is now the dosing strategy. And the dosing strategy will carry daily oral PrEP and the long-acting PrEP for our females. This is a female. But for the males, the event-driven will be added. This has been validated as per the gender or the sex of the client. So if you specify and say it's daily oral PrEP, then you'll be able to specify to click on the type of PrEP, which is oral. Then the regimen prescribed, you'll be able to see them there. And this will be able to change depending with, again, the sex. What you'll be able to see at TAF under the female, when you get to the males, you'll be able to see the regimen changing. If I select long-acting PrEP, the type of PrEP here, under the long-acting PrEP, you'll be able to see Cabele, the pivirine ring, and this is for females. where we'll be able to have males, we'll not be able to see this ring, and then we'll be able to see now lenacapavir appearing once you select the long-acting PrEP. And here, when you select any, for example, the lenacapavir into state number of months, we know it is twice in a year, so 6 months. And then I can now proceed. Condoms used, issued, sorry. So if it was issued, then you can be able to state and then give the number of condoms that were issued. Then you give the next appointment date. If you say no, you need to give the reason for failure to give appointment. If you say yes, then the system will allow you to click on add appointment. A pop-up will appear with the location service populated for you, and even the appointment type. So we get to the status here. I need to select the service. So the service here is the appointment that I want to create for this particular client. So it will be PrEP follow-up when you'll be coming. So it will be scheduled. This is the day when we are creating this appointment. So when do we want our appointment to come? So you can check after 6 months, and then you can be able to give that appointment. When you select, then you'll be able to see a calendar highlighting you with a different color, that particular date that you want to give to this particular client. And the number you see at the bottom here, those are the number of the clients that have been booked for that particular day for this specific service. So this is for you to be able to guide you to plan your clinics very well and not to overwhelm some days. Then you can proceed and save that. So you'll be able to get a notification that the appointment scheduled. Then you save and close. Sorry, okay. So that is how we'll be able to get that. Sorry for that. So after that, in the subsequent visits, that's when now you'll be able to see the PrEP follow-up form, which will be basically be, allow me to fill this very fast, and then so that I can be able to show the other forms. This was not using. So and already the appointment was saved, so I'll not redo it again. Yeah, you need to submit. Now the form has been submitted successfully. Then when I navigate back to this part, you'll be able now to see the other forms that are needed to be filled in the subsequent visits. I know you will not be filled within the same visit, but allow me to open, not filling them, but opening these forms and be able to show where the changes are. You'll be able to see the STI screening, and because these are subsequent, a subsequent now visit, not the same visit that we filled the initial. You'll be able to specify on the STI screening if that was done. The fertility intentions, we know these are some of the things that might change, just the same as we've done them in the initial form. Then here we'll be adding the pregnancy outcome, but this will be validated depending with what we'll be giving under there if the client is pregnant. So you'll notice that if you say the client is not pregnant, that section will be hidden and will not be required to respond to that particular section. Adverse drug reactions again will be there. The PrEP status as it was, but now a change is under the PrEP status. You'll not be able to see start because this is a follow-up. You can either continue, you can either restart, switch, or discontinue. Again, discontinue will be guided by what you give under the contraindication for PrEP. If confirmed HIV positive, then the system will alert you to discontinue this particular client from continuing with PrEP, and that is for the seroconversion. So again, here, if we say continue, you'll be able to see and say prescribe, you'll be able to see the dosing strategy as it was daily oral or even the long-acting PrEP, and this way you'll be able to see the Cabernet, the pivirine ring, and the lenacapavir, and you can be able to proceed as I had done that earlier. So this is just the same as filling the PrEP monthly, but we are availing them so that you can be able to fill these forms accordingly, as we've been guided even by the program on how we are supposed to fill the follow-up and the monthly refill. Then from there, what next? I should be able now to navigate to the order basket and be able to do a prescription under the drug order for our now for our the PrEP type that we picked, that is lenacapavir. So when you search for it, you'll be able to see it under that particular drug order. Then click on the order form. So on this, you'll be able to see this is the name of the our client. This is what we have in the stock. So in this particular instance, we've received some stocks of this particular drug. Then you'll be able to see what is remaining in the pharmacy and even in the main pharmacy. So in your instance at the facility level, what you'll be able to see here, it is according to how you've named your dispensing areas and where you've received these stocks into. So that is what you'll be able to see. And then here, I need now to do the prescription. And this is one pack. As we've been guided how it will be given. Then the routine. Then we give the frequency, which is every 6 months. You can be able to give any instructions if you have. Then when you get the prescription duration, you'll be able to see this, the start date of this particular drug that you're prescribing. Then the duration will be 6, need to drop days to months. Then the dispensing instructions, need to dispense 1 pack without a refill. And then you give the indication. Once that is done, you can review, then save your order. Your order will be saved at this particular step. And the reason as to why it is saved here, you can be able to add even another drug and another one. If it's something which is applicable to this particular client, then you can sign and close. Each and every time in the TaifaCare powered by KNYMR, for you to ensure that your form has been saved, you need to sign and close, and you'll be able to get a notification on your left bottom side that it has been successfully saved. So from there, then I need to navigate to show you how does now a pharmacist or any person in the dispensing area will be able to dispense that particular drug. Remember, we can be able to utilize, or we need to utilize our queues as we were shown. So you could be able even to click on assign and then be able to search for the next queue where you need to assign this particular client. And these queues are configured depending on the facility. So when the system is being upgraded, this will be configured to mirror what we have within the facility. Then I can assign to the next queue, and then you'll be able to see queue entry transition. So this client now that I can navigate to, allow me to duplicate this so that I can be able to showcase the other part. So on the left navigation panel, then I can click on home, which will take me to this landing page. Then I can navigate to the pharmacy. The system is role-based, so depending on what you do within the facility, it's what you'll be able to see on your left navigation panel. So I need to click on the pharmacy. I'll be able to see the active prescriptions on all the prescriptions that have ever been done. So that's the reason as well it might take time depending with the number of prescriptions which are there. So when I get here, I can be able to see the one that is active. So under the active, this is the only which is active. Under the all, these are all the completed plus the active prescriptions. So I need to come to the active. Then I'll be able to locate. This is my client here. You can be able to see when it was created, the prescriber and the drug. Then I can be able to expand here to be able to see more details, starting with if there is any allergy, if there is the conditions and diagnosis, the weight, the final diagnosis, the active. I can be able to see some of the clinical information, and then I get to the history. You can be able to see that. But for me to be able now to dispense, I need to click on the prescription details. And from here, I'll be able to see the prescription details here. I can either close if I am not going to dispense this. Maybe it is something that was done erroneously, then I can close it. Closing, you're closing the entire prescription. You can either pause, maybe you don't want to prescribe this at the moment, but later, that is when we pause. you can either modify. That is the time when you feel this prescription needs modification. And when you modify, you can alert the clinician to do it, or even yourself can be able to modify that particular prescription. But because you want to dispense, then I can be able to click on the dispense, be able to see again these details for this particular client. This is the drug. This is the quantity that was prescribed. So I can be able to see under the quantity, I need to specify that. And the reason as to why we left it open for you to specify it because sometimes, yes, under the prescription, when you're prescribing, you can be able to see we have so many or maybe some stocks in the our dispensing area. But when you get there, they may be limiting some of the drugs due to some emergencies. So they may not give you for a long period due to some of the emergencies. So that's the reason as why you left this for you to be able to specify whether you're going to give the entire quantity prescribed or you're going to give half, then this particular client will come later and get the rest. So this is the information. It is read-only from the clinical team, the clinician who prescribe. You can give your own instructions as the pharmacist. So this is the date we will dispensing, the name of the person who will be dispensing. Then under the stock dispense, you'll be able to click here and see a batch. Right now, I cannot be able to see a batch. Why? Because I need to change my location to be a dispensing area. That's the only time we'll be connected to the stocks within the system. So allow me to change my location to main pharmacy. Main pharmacy, then I can change that. And then you'll be able to see now I'm in the main pharmacy. So when I expand this and try to dispense, this is one, then I'll be able to see what is remaining. So the batch will appear. This is the batch. This is the quantity remaining. And then we can be able even to see 200 packs and the expiry date, 18th May 2027. So if you have very many different batches, fee for year will apply first in, first out, and even looking at the expiry date so that you can be able to start dispensing the ones with the short expiry date. So then I can dispense that and we'll be able to get the notification that stock dispensed, medication successfully dispensed, meaning that it has even deducted from my stocks and I'll be able to get that very well from the stocks side. Again, as I finalize, when you navigate to where we can be able to see what we've done, it's good for you to be able to confirm, get to the clinical encounter under the patient chart, then locate visits, click on the visits. Then under the visits, you can be able to see today, expand that today. Then we'll be able to see the timeline that will be able to give you all that has been documented. This is necessary for you to be able to ensure that you've captured the right information and even you can be able to see the provider and the time then when it was started. If you want to confirm the specific, click on the encounters, and then from there you can be able to see these specific encounters and you can be able to expand them and see that is what we are now documented. And this will even help you when we'll be generating the reports. Again, you can be able to utilize all these to be able to give even the medication that you've given to this particular patient. That's all for PrEP module. And over to you, Otieno.
Thank you,
Otieno?
Eric. Yeah, thank you, Eric. I think our next presenter is Mary Kileve, who will be taking us through the data transmission process for this particular version. Welcome, Mary.
Hello, good morning, everyone. Just a minute, let me share my screen. Yeah, so I'll be going over data transmission. So as has been presented, there are some additional variables that have been added to TaifaCare, and we'll need them to be transmitted to the data warehouse. So DWAPI datasets, PrEP datasets have been updated with these additional variables. So these are just these are the names of the variables that have been added. Type of PrEP, other reason for PrEP, reason for switching, date of switch, dosing strategy, on contraceptives and so forth. So they've been, if you need any more information on these particular variables, you can get more on the Kenya HMIS data dictionaries. So yeah, these variables will be transmitted using the next version of DWAPI, which is to be released soon. So there's not much change in the process of transmission. After you've upgraded your DWAPI and TaifaCare or Kenyamar, you just navigate to the Kenyamar dashboard and go to the ETL admin section, and you'll just be able to refresh the DWAPI tables, and from there, DWAPI will be able to load the new variables and send to the data warehouse, where it can be processed in preparation for analysis to be done on it. So yeah, there's not really any additional steps to be done there. So I'll just end it there and pass it to Lillian to present on PrEP dashboard monitoring. Thank you.
Thanks, Mary, and good morning, everyone. Please let me share my screen. Good morning once again. My name is Lillian. I'm going to make a presentation on the PrEP monitoring dashboard in the National Data Warehouse. So you will access the National Data Warehouse as just as usual, the way we do it, and we've added we'll add a tab on PrEP monitoring dashboard in the case surveillance dashboard. So when you log into the case surveillance dashboard, there will be a tab on PrEP. When you open this tab, then this is going to be your home page. On the left side, we have the filters section. You'll be able to filter your data according to the assessment period, the county, the sub-county, the facility, the sex, the age category, the agency and partner. Please note that I'm currently using a mock-up, so I'm not able to filter out for you to see the changes, but this is just a replica of what you will see on the dashboard. Then we will have two tabs as seen above here. There is a PrEP initiation enrollment tab, and there's a PrEP seroconversion and PrEP switch. So on the cards up here, we'll have the PrEP new pregnant women, then the PrEP new breastfeeding women. Below that, we'll have a chart showcasing the PrEP enrollment by dosage strategy. Then we'll also have PrEP enrollment by dosage strategy in terms of the different regimens and the patients that have enrolled for this specific strategy. So the three strategies will be showcased here. Then we'll also have some charts showcasing the PrEP new by county and PrEP new by partner. That's all for this page. When we move to the next tab, it shows the PrEP seroconversions. You can as well use the filter section. The PrEP seroconversion and the PrEP switches, that is the overall numbers. Then we can also define the PrEP seroconversion by PrEP type and PrEP seroconversion by regimen type. Then there'll also be a chart that will be showing us the PrEP regimen switching. That is for a specific period of time. The client has switched from which PrEP type to which PrEP type. So it will definitely give us some insights on the PrEP switch within a specific period of time. That's it for now. This is just a work in progress. You'll be able to see it when the work is done. Thanks, and over to you, Otieno.
Yeah, thank you, Len, for that. So as we wind up this particular training, I just want to share some links, especially for you to kind of go through. The links include the resources for the SOPs for this particular version, and also the YouTube link. So I just want to share the screen. Len, you can share your screen, please. Let me just share the screen. Yeah, so these are the links that I'm talking about. So one, we have self-training resources that you can find from our official website page. The link is provided up there. Then we also have the YouTube link where you're able to access all the videos, the short how-to resources that you can interact with. Just for learning how to navigate different components of TaifaCare powered by Kenya EMR. The third is we have a community platform where you can also participate in the FAQs, where you're also able to respond to different community members with the questions that they post. You can also post your own questions and you get answered by the community. So it's a very interactive platform that I'll encourage each and every one of us to join. Lastly, we have the service desk line for any technical issue that you'd want us to resolve. Our dedicated service desk team will be able to receive those calls and support you. The line is toll free, so you'll be able to call whether you are low on airtime. Yeah, so let me just show the actual links. Okay. Yeah, so allow me to reshare. So for the resources, you'll have to come to our Kenya HMS page. Under the home page, you'll have to go to the resources. I hope you're able to see. You'll have to go to the resources. Yeah, under the resources, then we have the learning resources, the YouTube, the documentation manuals, the FAQs, and the HIS e-learning portal. So of importance for now is the HIS learning resources, where if you click more, it will take you to all the SOPs listed here. So you just click on which one you want to access. For instance, if you want to learn more on how to navigate the PrEP module, how to document the new PrEP regimen, lenacapavir, you just come to this particular resource, PrEP service documentation. It will give you a whole documentation process of that. Yeah, then you can also interact with the YouTube link. Yeah, you can also interact with our YouTube link where we have short videos and even the training recordings. As you can see, we have a recording for yesterday. For those of you who were able to attend yesterday's training session, we have this one also recorded. I will be able to upload it immediately after this meeting so that it can also be available offline for your review and reference after this particular meeting. So you can see we have all those resources in the YouTube. Feel free to access. Then I also talked about the community. I talked about the Kenya community. So this is a community where you're able to post your questions. Somebody else will be able to respond to you within the community. So I'll urge you to access that and even subscribe so that you're able to also participate as part and parcel of the TaifaCare community. Yeah, so that's all I wanted to share. So in case you have any question, post them on the chat area so that then we can respond as we proceed. Otherwise, I want to pass this over back to NASCOP. Elvis, if you're available, take it over and take us through the call to action and the next steps. Thank you.
Thank you. Thank you very much, Bernard. Thank you very much, Tim. So I think we'll move to the next step, that is call to action. But as I don't know, Diana, are you able to project, or Lillian or anyone, the call to action?
Elvis, this is
Yes.
Franklin.
So Franklin is around. Okay. Yeah, take it up, Franklin.
Yeah. Thanks, Elvis, for standing in on my behalf. Apologies, team. I wasn't able to join you earlier on because I had another competing task. But thank you, Elvis, for standing in for me, and of course, thanks to all the presenters, Otieno, Lillian, Eric, Marianne, and all the other participants, including thanks to Dr. Jonah for opening the meeting for us. So I'll take you very quickly through the call to action. So allow me to share my screen. Yeah, so my name is Franklin Songok. I work at NASCOP in SI. So I'll take you through the call to action. I know we've been taken through the objectives of this particular why we're introducing the molecules. I really don't want to belabor so much on that because Dr. Jonah must have covered that. We've also been taken through the documentation bit. So there are some asks for the teams in this call. That's the partners in the county teams. Remember, we had divided the counties into two teams, or two clusters, cluster 1 and cluster 2. So we had cluster 1 yesterday, and this basically covers the phase 1 of the counties in terms of this rollout. So the 15 counties are as listed on my slide. That is Busia, Homa Bay, Kajiado, Kakamega, Kiambu, Kilifi, Kisii, Kisumu, Machakos, Migori, Mombasa, Nairobi, Nakuru, Siaya, and Uasin Gishu. We've worked closely with the CHMTs, of course, with the coordination of the task force to be able to establish the lists where the rollout or the pilot will be conducted, and we so far I think we've received concurrence from all the counties. But in case you still have any reservations about 1 or 2 facilities, we are still open to be able to revise that list and at least. So most of the counties have picked about 10 facilities, but some have picked more than 10, which is still okay as long as you're able to manage and as long as the facilities meet the criteria. More importantly, we've been, of course, through SI and the Palladium team, we've been working on on the enhancements within the EMR. I'm sure this must have been mentioned that in this first phase, in the 15 counties, we will leverage on EMR. So meaning all the facilities that we've picked must be utilizing EMR currently. So we are hoping that before the end of the day, we should be able to, we should share with you the new package in readiness for the upgrades. And this is where we will really require lots of support, of course, with the coordination of the CHMTs in collaboration with the service delivery partners. We really want you to prioritize more, especially the counties, the facilities that you selected to pilot. So the CHMT will be expected to provide leadership and oversight in this rollout. Once the package is released, the expectation is that all the cloud sites should be upgraded by Monday, that is the 23rd Feb, and on-premise sites should be upgraded by Wednesday, 25th. I'm hoping that this has also been mentioned, that the first client really is expected to be injected on 26th. That could be on Thursday in Iriruta. So the expectation is once that happens, then all the pilot sites should have received commodities, and you should be ready to then dispense and of course provide the service. And in this case, then it means you should have ensured that the sites that were picked have already upgraded. So by 26th, all the sites should have been upgraded. So we really need to work engage overdrive to ensure that our sites that we picked are upgraded with the new version. We'll have a team available for support, either in person or remotely, and we also have the service. This team will always be available to support in case you run into any challenges during the upgrade. So facility staff would be expected then to ensure that the PrEP module is utilized. One of the things that we've noticed is that this is a module that is really underutilized. So once the upgrade is done, we will really encourage service providers to utilize this module, because this is our only source of data at the national level. So the expectation is that we'll leverage on the case surveillance upload, so meaning the data will be streaming in on a daily basis. We'll also be able to just rely on the schedulers that have been set to upload the data to the national data warehouse on daily basis. I think you've already seen the dashboards that Lilian has shared. They are embedded in the case surveillance dashboard of the case surveillance section. So that means all the data will be streaming in, including what we are already currently implementing for case surveillance. Remember, this is very critical. The leadership at the MOH level will be following this very closely. So we really require your support to make sure that this data is streaming in on daily basis. The ongoing training, of course, the recording will be uploaded to the YouTube channel. I think Otieno has already taken us through how to be able to access. So as soon as we are done with this training, even the training we had yesterday, we'll be able to post. The SOPs have also been updated, and I think is also be able to guide us on where we'll be able to get those SOPs. So kindly, in case there are any areas that you're not clear on, please make sure that you refer to the SOPs, refer to the recordings for purposes of just updating ourselves and ensuring we are up to speed. There's someone whose mic is on. Elvis, can you help mute, please?
I'm not the co-host. I think Bernard.
Otieno,
Dan, can you mute
Duncan?
There's Duncan.
Yeah, so I think the last point is that monitoring of the upgrades will be done using the dashboards of the National Data Warehouse. So once you've been able to upgrade, we'll be able to monitor that very closely. And I've said, and I'll emphasize, in case you have any challenges, please do not hesitate to reach out to us. We'll always be able to support you, because we want this process to be seamless, so that we have visibility of what is going on. The expectation is that all the clients, including the initial client, will be followed closely with a lot of interest. And the only way we can be able to monitor that is by ensuring that we upgrade our sites, we update, and we document appropriately. So these are some of the activity monitoring and technical support that we would expect. One is ensure that all the sites are upgraded. We will start with the selected sites, and of course, nothing stops you from also just scaling this up to the other site. Because I mean, the expectation is that at some point we will be able to scale up PrEP. And of course, again, the module the package that will be released is not just confined to PrEP to PrEP enhancements. It also has other enhancements. So we would first and foremost encourage you to prioritize the 10 sites. Then after that, then you can extend this to the other sites. Of course, the service desk team will be available always to support you during the working hours. Please, whenever you encounter any challenges, make sure that you reach out to them. We've also organized ourselves in such a way that we'll have officers who will always be available to support you. So we have the health informatics team from Palladium working closely with the NASCOP team to provide support. And like I mentioned earlier, it's either in person, in person or remotely where necessary. So if you feel that you really need support physically, please reach out to these particular officers who will be able to support you. So we have again just clustered the counties, and then we've also assigned we have assigned HIS focal persons to be able to provide this support. So Kilifi, Mombasa, Kajiado, Moses Care, working closely with the NASCOP team, will be taking lead in providing either physical or remote support. Then we have Machakos, Nairobi, Kiambu. Mary Ann will be taking lead on that. The phone numbers is there, so if you don't have the phone number, you can just take a screenshot of this, or you can just copy the numbers or the phone numbers. We also shared this with the teams that we had yesterday, but I'm just repeating just in case, because I know some counties are cutting across. Kisii, Homa Bay, Nakuru, some officers, sorry, are cutting across the counties. Kisii, Homa Bay, Nakuru, Siaya, Benada John will take charge, and his phone number is there. And then finally, we have Kakamega, Kisumu, Migori, Uasin Gishu, and Busia. Frida Oyucho will be taking a lead in this. I'll be sharing this after this call. I'll be sharing I'll PDF this and share with you for purposes of referencing. I'll also be able to capture the useful links to the resources. In this case, the training resources, the YouTube resources, the Kenya HMIS community, and of course the service desk number. I think Otieno has already taken us through this, so I really don't want to belabor so much on that, but I'll be able to share with you those links so that you can always be able to navigate and access any material that you feel would be useful for this particular activity. Otherwise, I want to pause there and say thank you very much. We are looking forward to working closely, first and foremost, to ensure that all the sites are upgraded. Thanks, and over to you, Elvis. Was I heard, Elvis?
Yes, yes, you were very clear.
Oh, seems like Elvis dropped, but it's okay. Yeah, so yeah, someone is asking some numbers here. I think I mentioned that I'll be able to share with you immediately after this call. So I'll be able to PDF it and then and share with all of you. So at this point, I think we've basically come to the end of our training. So in the absence of Elvis, I'll be able to just step in for him so that we can close our meeting. Maybe Diana, any remarks or any parting shots or a rejoinder to the call to action? Any comments?
Thanks, Kongok, and good morning, everyone. I don't think I have anything to add, just to reemphasize that from Palladium's end, we are ready to support to ensure that the process is seamless, providing the systems and the resources, human resource, to just ensure that the teams on the ground, we support the program so that this phase is successful, and not only for phase 1, but until all the other counties are supported. Just to mention, I know there are some people who have chatted to me directly. For AMRS sites, also the MRS has been enhanced, so they also have the drug, and they'll be also submitting that to the warehouse. So we will be able to monitor those facilities regardless of the system that they're supporting. So back to you, Songok.
We tried our best, but God had other plans. Unajua sasa mambo ya Mungu pia hatuwezi ambiana ati ilikuwa. God had other plans.
Otieno, kindly help to mute Paul Kimani. Back to you, Songok. Songok, can you hear me? Kezia, am I audible?
Yes, Dana, we can hear you.
Yes, you are.
Oh, Songok is muted, so okay. So okay, then I can hand this over to Ruth Kamau to
Diana, sorry, I experienced some blackout where I am. Sorry, it was network. Apologies. Yeah, sorry, but I guess you're done, Diana. Sorry.
Yes, I am done.
Yeah, I left when you're responding on some questions regarding AMRS sites. I hope you've been able to respond to that.
Yes. I've clarified that they've already enhanced the system, and the data will be flowing to the. They've also enhanced the WAPI from their end, so the data will be flowing to the PrEP dashboards. So at the national program, the program team would be in a position to just have a national view of what's happening in all the facilities that have been selected for this phase.
Thank you. I don't think I need to add any more on that. Thank you very much, Diana. So at this point, allow me to welcome Ruth from the program to maybe close the meeting for us. Otherwise, from my end and on behalf of the SI team, we really appreciate your support and looking forward for further collaboration in ensuring that this is a success. So from my end, thank you very much, Ruth. You can close the meeting for us and also pray for us. Thank you, and bye from my end. Over to you, Ruth. Yeah, Paul, you can go ahead, Paul.
So thank you, Songoka. Thank you very much for the detailed presentation, and just to assure the counties that we are available to support in the parts of program, and also scaling up of long-acting pre-exposure prophylaxis. So I think it has been a very productive meeting, and I think we need to close so that we can go to another engagement. So let us pray and close the meeting. Our Lord and our Savior, we just want to thank you. We want to honor you and glorify for who you are. Father, Lord, as we started this meeting, we committed ourselves before you, and we thank you, Father, for bringing us to the end of this meeting. But as we plan to introduce the long-acting pre-exposure prophylaxis in the country, we pray that, Lord, you will favor us and bless the work of our hands as we serve the population in this country. We honor you, Father, and we bless you. In Jesus' name I do pray. Amen.
Amen.